Andy Masacchio is my name. And from
how old are you?
67.
Okay.
And just last September, not
Right.
too long ago.
Right.
And, was in America and did a lot of skiing. I did a lot of playing golf, and noticed several years ago that I had a hip problem, and tried everything to make it better, but nothing worked, and figured I needed an operation at some point and get a new quality of life. And was in Thailand, visiting in Thailand. I've been visiting in Thailand quite a while, and found out about the healthcare in Thailand being much less than in America, and it was investigating getting a hip replaced, or getting the options that were available for fixing your hip. And in the process of doing that, I discovered that India had many more doctors, many more hospitals that were doing advanced surgery for the hip and hip replacement. And a new method, it was new to me, was the Birmingham method, which of hip resurfacing, which actually it's not as invasive, not as damaging to my hip. So that's what I was looking into, and found Dr. V. He was in Chetnad Hospital in Chennai, India, and corresponded back and forth with emails, and sent pictures of my hip, x-rays of my hip, and we talked about it at length, and I decided it's time to come here. So coming here and having the operation was the best thing I've done. Should have done it 5 years ago. I would have been happier 5 years ago. But now I think everything's going to work out fine. Just had the operation Friday. Today's Wednesday. And I'm leaving the hospital, going to a resort, to a hotel by the ocean, rest and do my exercises and get better.
What was the operation?
The operation was surprisingly easy. The preparation for the operation, I've never done a spinal before. That took a little longer, but it was easy. Spinal was easy. I didn't feel a thing. The operation was about 2.5 hours long. And I thought everything was fine. Since the operation, I'm a little uncomfortable in bed, mainly from lying on my back, I think more than my hip. My hip doesn't seem to hurt much. I've stopped pain pills. I stopped pain pills, I think, the second day. I didn't even take any more pain pills. So, yes, the operation was...
So how is your mobility now?
How is what?
How is your mobility? How are you getting around?
Oh, yes, mobility. Well, it's a little scary because I wanted to start running right away. And I knew that wasn't going to happen. So used a walker, which was very easy. I'm aware that it needs to heal before I do too much, but quite comfortable. And now I'm on these single stick crutches just to take weight off of the hip while it heals. And I feel it won't be long. Won't be long.
How do you rate the hospital and the services here?
I was very pleased with the hospital. A lot of attention. There's a lot of good nurses coming in and out, making sure everything's okay, checking the blood pressure and everything. And the hospital itself is neat, clean, modern, and it's a hospital. I'm real excited about being in a hospital, but I mean, if you have to be in one, this one's fine. It's a great hospital. And the prices compared to Thailand were quite a bit less. if I'd had the operation in Thailand, there was only one surgeon that I found able to do the same operation, and he'd only been doing it for a couple of years. I didn't feel real comfortable with that.
Would you have gone back to America to have had this operation done?
I wouldn't even have thought about the operation in America. I couldn't have afforded it. There's no way. It was just out of the question. So finding India, Dr. V was the best.
Would you recommend that fellow Americans who are in a lot of quandary now, especially the baby boomers who are about to retire or just retiring, would you recommend that instead of waiting and having to shell out money from their pockets, they should come over here?
Yes, as a matter of fact, I've already spoken to some people.
All right.
And I definitely recommend it. It's the mindset of a lot of Americans is that they want everything done in America, but they need to open their mind a little bit and see other possibilities. One thing that really sold me on England too, on India too, was that most of the doctors were trained in England, and everybody speaks English. You know, so in Thailand, no. If I was in the hospital in Thailand, the doctor spoke pretty good English, but nobody else did. And the nurses don't speak English. So the communication is definitely good in India, much better.
Thank you very much. It was a pleasure having you, Rick.
Thank you.